Hello, hi everyone. I hope you're all well. Welcome to our educational flu event today. My name is Simajit and I'm one of the customer success managers here at my GP. With me today, I have members of the customer success team and a staff practice who share their previous experience and challenges they will face this flu season. In today's session, we'll also be doing a couple of demos and take all your questions at the end. Now, before we get started, I just want to remind you all that we have a prize draw as a thank you for attending this event. One lucky winner will receive a luxury afternoon tea for two at an Ivy restaurant of your choice. Again, details will be disclosed at the end of the session. Did you know 61% of patients were unsure of how to book a flu jab, plan to call a practice reception for guidance? 76.6% of patients view SMS invitation as a preferred communication format regarding information around flu vaccinations. And 95% of patients who are eligible for a flu vaccine will not book until they've sent a text reminder. And then 20% of patients are not aware if they're an eligible group of vaccination. This information was taken from a recent survey we conducted with 1,000 patients. I'm now going to pass it over to my colleague Amanda, who'll explore this further.
Thank you, Simajit. Hi, everybody. I'm Amanda, and I'm also a customer success manager here at my GP. Now, for today's event, we've spoken to several healthcare professionals to share their experience of managing a flu programme, together with their expectations and challenges that they envisage facing this year. Simajit and I would like to introduce to you Roy Salaja from the College Road Surgery in Birmingham and the Solihull CCG.
Hi, Roy.
Hi.
Hi, welcome to this flu education event, and thank you for giving us your precious time. Roy, do you think it's more important this year than ever for patients to have or be given the flu vaccination?
I think there's always many reasons to make sure patients receive their influenza vaccinations each year. Because of the current COVID pandemic and where we are at the moment, I think getting the flu vaccine for the 21-22 period will be more important than ever, and that's just my opinion. But obviously the flu vaccines won't prevent COVID-19, but they do obviously reduce the burden of flu, hospitalizations, deaths, and also the pressure on the healthcare system. So yeah, I would say it's probably more important, in my opinion, this year more than ever before, really.
Absolutely, no, I agree with you. Now, in previous years, what challenges have you faced in inviting patients for the flu vaccination?
I think we in primary care face numerous challenges year in, year out, but obviously one of the biggest challenges we faced, and especially when we're using technology now going forward, is having the incorrect details for patients, mainly, for example, with iPlater, the phone numbers, mobile phone numbers and so on. So what we've started doing at College Road in the last 2 to 3 years, as a matter of good housekeeping, is just continually reviewing, modifying and updating patient details as and when we have any opportunity to do so. One of the tools we use to do that is the iPlato daily reports, which we receive, which we indicate where the numbers are incorrect, so we can either take some action around that. And we're also continuing just making sure we have correct details for patients as and when they come to the practice as well. Other challenges: patients not answering phone calls, not being able to leave messages with patients because of GDPR. So sometimes the text service is second to none in beats a lot of those kind of challenges.
Yeah.
And also is kind of more advanced than the conservative types of invites, such as letters, which we've been using previously.
Again, agree with what you say, and I'm glad you mentioned the importance of keeping numbers up to date. And this is something that we recommend all our practices to keep on checking those fairly expired numbers. Not only is it good housekeeping, it also prevents, extra credits being used up. So thank you for that. Now, the third question, Roy, have you included the option for patients to decline the flu vaccination from the invitation that you've sent? And do you think it's helpful that this can be recorded into the patient's medical records?
I would have to say yes, Samjit. I think that's probably one of the best functionalities that we've kind of utilized over the years since we've been using iPlato. It's a brilliant option for practices. It reduces the burden, workload, manual workload that needs to be done also. And it's such a very simple process. I think the first campaign I did, I contacted, I think, Chris from your IT help desk, and he talked me through setting up a campaign. But it saves a huge amount of work, and also it stops us having to go back to patients continually after they've declined services. So yeah, the option does work very well.
Brilliant, that's great. That's the kind of stuff that we want to hear. All these automated processes actually do work.
Roy, can I just ask you? The cohort of eligible patients has been expanded this year to include children up to 17 years of age. Now, do you think this will present additional challenges for your practice?
Definitely, Amanda. I think because where we are with just coming out of the COVID pandemic, returning to business as usual, we have COVID-19 vaccine clinics going on, and we have a backlog of patients in terms of some of our chronic disease registers that need reviewing. We're already under quite a burden of work in primary care. So the cohort up to 17s will present additional challenge just by the nature of the fact it's more work. I think primary care is very resilient, and I would say that that age group is more tech friendly, more tech savvy. So that's something that we will be using iPlato in terms of text messaging as an invite, which seems a perfect method for that cohort of patients. We're going to use coded feedback again, like we just touched on previously, to help automated coding into the patient records, and that again will reduce our workload. So we're trying to use technology to kind of help us through and try and work smarter rather than harder, and that's where kind of we've used iPlato in the past, and we will be again using iPlato. One campaign that some of your delegates might want to think about is not only a decline coding back into the system, but also a code, a trigger word such as yes. So they send the invites out to say these patients, and if the patient wants to book an appointment, they simply trigger word yes back into the clinical system. You pick those patients up with that yes word and you contact them, and you know those patients are purely just to be phoned and booked in, and there's no further conversations needed. So that's better for easier and less experienced staff in the practice.
Thank you. It definitely sounds like you've done quite a lot of planning and processes that you've got in place. Now, this year's flu enhanced service specification now requires you to code patients' ethnicity as data that you need to collect. Is this something that you're already doing in the practice, or if not, how are you planning to achieve that this year?
This is something we're doing, Amanda, already. We've been doing this now for a number of years. We do it as part of quite a few processes. So practices may wish to pick this up as part of their new registration process when the patients are filling the GMS1. Also new patient checks when they're being seen for the first time by the nurse or the doctor. And also opportunistically when patients are coming into practice. We're getting our admin staff to pick up on this. We're also getting our clinical staff to pick up on this area where it's appropriate. We're also collecting this kind of data during vaccination campaigns such as flu season. So this is a perfect opportunity when that patient comes in, you do the flu vaccination and you just capture that data and code it into the clinical system. COVID-19 vaccination program also gave us that opportunity. And I know as a practice, we're obviously interested in what iPlato is developing going forward, and I know there are templates being created that maybe possibly one could be created to kind of capture this kind of patient data, which will be a real benefit to practices and really help going forward with capturing ethnicity data, which is part of the contractual terms.
Thank you. That's really interesting, Roy, because we are shortly going to be launching patient questionnaires as one of our features, and this will allow practices to collect data such as ethnicity from patient groups. and I'm sure that'll help with data collections for the flu enhanced service specification going forward. You know, any practices wanting more information on this can just contact the customer success team at customer.success@iplato.com. Now, the JCVI has advised there shouldn't be any problems with vaccination deliveries in time for the start of the flu programme. Is this your understanding too?
Yes, indeed it is. I think some vaccine suppliers have indicated early on in the campaign, the process this year, that the vaccination ordering may be having a reduction of up to 30% for the under 65s. But most practices should be okay with that. They should have over ordered this year because we're covering the over 50s category anyway. I think in terms of delivery and stuff like that, we're hoping it's going to be a smoother process than in previous years, and that should be the case. And I think most CCGs are allowing flu vaccines to be carried out at the local practice level now, instead of insisting it be done at a PCN approach, which makes total sense for patients, practices, and also just the general uptake levels patients.
Yes, I'm sure that will make a lot of difference in that you can organise things yourself and patients are much more familiar with coming to your practice. So for our last question, can I just ask you, how are you planning on using our MyGP Connect system for your flu season?
Yeah, the MyGP Connect has a lot of potential benefits to practice in terms of its functionality. It's something that we're seriously looking at to utilize more going forward, and it's quite impressive in what it can do and what it can offer to practices and help reduce workloads. It obviously can have the impact of reduction of phone calls to the practice, so patients can book their appointments through the app. It's also able to automatically clinically code back into the patient journal, which is obviously a very important feature. It can be used to conduct and control a campaign in terms of sending out messages and looking at call and recall, which is really important. And a lot of functionality is free and supported or funded by the CCG in terms of text messaging and so on. It's better control of your appointments booking. That's something that we're looking to utilize. And you can actually run quite a few campaigns consecutively. So this year, for example, we can run the COVID campaign, and also we can run the flu campaign. So it's got a lot of functionality that we'll be seriously looking at utilizing going forward.
Thank you, Roy. I'm sure you can all relate to the challenges that Roy mentioned and have hopefully learned some new or different ways of managing your flu programme this year. Thank you for your time again today, Roy. It's really appreciated.
It's been a pleasure. Thank you.
We're now going to take a look at the solutions that MyGP provides. Now, it would be wrong to suggest that digital technology can address all the challenges that GP practices face by itself. However, after supporting our vast care network of users and commissioners over the past 17 months, we feel we've developed an overall solution that addresses most of the urgent challenges. And today we will focus on 3 features: MyGP Connect, MyGP app, and population health. With flu season on the horizon and COVID vaccines still taking place, MyGP provides you as a practice and your patients with some simple, easy to use functionality that not only reduces your admin burden, but also increases your patient uptake. The MyGP Connect platform also helps you reach those patients that don't engage with the practice. As Simajid mentioned earlier, results from our recent survey showed that SMS is seen as the preferred choice of communication by patients. Most practices on our call here today are already using the Connect platform to send bulk campaign messages as their line of communication with their patients. You'll be aware that this also allows the coding of invitations directly into your clinical system. This functionality also captures and codes specific patient responses too, ensuring that patients' medical records are fully coded and kept up to date with patients' intentions of taking up their flu vaccination. or if they don't require this. With the added ability for patients to easily cancel an appointment that they've received, whether that be a simple click on the MyGP notification or by replying cancel to their SMS message they have received, our inbuilt functionality allows the recycling of unwanted appointments and also reduces those that would previously just have been a DNA on your register. Practices that are on board with MyGP will be able to communicate with their patients, including appointment reminders and campaign messages, free of charge, as these will be sent as data messages. Patients with the MyGP app will receive in-app information from the practice. This can then be enabled to provide them with the ability to book an appointment directly from the call recall invite that the practice has set up. This not only allows you to send mass communications to your patients from a single campaign message, it also reduces the needs for patients to contact the practice to book their flu appointment, which will hopefully reduce the amount of incoming calls you receive in the practice. By using this line of communication, you are ensuring that you as a practice are in full control of which patients are invited and able to book into a flu vaccination clinic, so that the patients are seen by the correct healthcare professional with the relevant skill set, and all appointments are booked into clinics with times that you have configured. Simajit is now going to talk to you about population health.
Simajit, we would love to hear from you, but you've gone on to
Again,
mute.
well, I'm muted. I'm so sorry. This is not good, is it? But I'll start again. Right, population health allows centralized working at a PCN, CCG, and ICS level. Now, some CCGs already have this in place where they would manage the service and hub would send messages to patients on behalf of the practices. Now, this ensures consistency with messages being sent, keeping the costings to a minimum, and messages sent at allocated time that is not dependent on a practice resources. There's also the availability to include chatbot interaction. This helps alleviate the patient concerns and myths in respect to the campaign that you're running, so it stops the misinformation which we know is out there. Population Health are also now offering a flu vaccination web booking system like the COVID booking service last year. This is managed by the hub team. They set up online flu clinics on behalf of the practices and send patients a message with a link on how to book into an available slot provided by the practice. There's never been a better time to see how MyGP can help. I'm now going to pass over to my colleague Dan, who will demo MyGP Connect and call and recall feature. For more information related to population health, please email hub@iplace.com. Thank you.
Thank you very much, Sim. Yes, welcome everybody. I was the voice right at the beginning. Hi. And I'm going to very quickly run you through the solutions that are available in your MyGP Connect system today. Some of them actually our previous speakers and Roy, our guest speaker today, all touched upon. So we're going to have a look at those today. The first thing we need to do, of course, is log into our system. So here's our login page that we all know and love so well. So I'm going to click login. And that's going to take us to our main home summary page. Now, I just want to let people know we are using a training demo site that we use here for training purposes. It'll look the same as yours. There might be a few simple differences. Don't worry, it's just the difference between your actual site and a training environment, that's all. So if we want to create a health campaign and we want to send a batch message to our patients to let them know of, say, the flu jab, then the first thing we need to do is actually run a search for those patients in our clinical system. So we would run a search and export those onto either an Excel spreadsheet or a .csv file. Either is absolutely fine. And in true Blue Peter fashion, here is one I made earlier. Now, for our Vision and System 1 users, as long as there is a patient ID column, you are good to go. If you are a System 1 user, just make sure that you've got a column for the NHS number and you'll be good to go. Today, I'm just going to work off the ID. I'm going to ask the column to be highlighted and to copy it. Now, I've only got a few patients on this list. Obviously, for your own, you might have significantly more. Once you've copied the patient IDs or the NHS numbers, we come back to our Connect system and we go to our campaigns menu. And we click on groups. That's our first stop. We've got a few different groups here. Don't worry if you don't see as many on your own system, that's fine. So we're going to create a new one today anyway. So I'm going to go straight to create group. And I'm going to put in a group name. So this can be as specific as you like and could be as specific as the search you've done in your own system, for example. I'm calling mine Flu Vac Invites 2021. It's patients we're messaging, so we leave that as patients and we click add recipients. Now here we can add patients individually if we wish by looking them up by name. However, we've got a group of patients we want to send to, and you're going to be dealing with large batches of information. So we're going to use this box in the bottom here, patient IDs. Again, top tip for our System 1 users, just make sure that says NHS numbers before pasting in. Again, I'm using the IDs, so I'm going to paste those in. They are there, it's just a small box, so all we do is we move them across to the right-hand side. And we can see our patients here. Now, when you do a search in your clinical system, you're bound to pick up a few who are not registered with a mobile. And you'll be able to see who those are by clicking the excluded button here. On my search, I didn't have anybody. If you did have anybody registered without a mobile, you'd be able to grab the details by copying and pasting them out of here, pasting them somewhere safe because you're going to need to message them another way. If I click included, my original list will return and I can click save. And there you go, that's gone in here. So the group name is on the left, when it was created in the middle, and the number of members, in this case 8, showing here for my patients. Now I've got just a few here. You can actually send up to 6,000 to patients in one go, in one group. Just be aware, sorry, excuse me, that if you are sending that many, you are going to get responses from a group that large, maybe even some phone calls. So just to be aware of that. You can always break this up as well. You could create multiple groups for the same campaign and have the system send them out at different times. Final top tip on groups. When you create your group, the date that it was created or last changed, that will remain static. It does not change until you make a change. So if you do create your group, but it is a few weeks before you get to actually use it, maybe either edit or indeed just delete your group so that you have the most up-to-date patient data when you come to send it. So I've created my group. What I need to do now is go to campaigns and double check my templates. So when we click on templates, again, you might see quite a few on your own system. You may only see 1 or 2. Everybody will be preloaded with, from our support team, a flu template, one that you can use and edit and change as you need to. I've got a few variations of that here as well. We can see each template is given a subject, and I've got a couple of different flu ones here. Now, if I need to create a brand new template, then some of you may have already spotted, we just go to create template at the top here. Now, it does want to sign it away under an existing header, which, if appropriate, you can do so. I like to always give a new subject for every template, so I'm going to create a subject for this one, and I'm going to call it exactly what my group was. I'm then going to paste in a template. Now I've taken this template from our help page. I'll show you where that button's located at the end of our little run through here. And there are a number of templates that you can use. Now feel free to copy those and you can either use them verbatim, just changing some important details like the telephone number. If you want to, you can obviously edit and change them as much as you need to. They are your patients you're messaging. You're going to know them best and how they'd like to be addressed. Now, text messages are meant to be quite simple and straightforward. So we have your surgery. We've done an example with the surgery name at the front here to grab the patient's attention. But then we've got what we call a mail merge here. Now, this mail merge is designed to fill in the first name of the patient in your group. So if you are messaging those harder to reach groups, like maybe teenagers who are registered under a parent's mobile, the relevant name will show here so that that person can give the information to the relevant person being invited for their flu jab. We also have the trigger word here, in this case, the word decline, as we heard earlier. Now, at the moment, that is just a piece of text. It doesn't mean anything until we assign it a clinical code. So that's going to be our next step. I'm going to save this first of all. And that's gone into the system and we can find it here. Here we go. Everything's alphabetical on the templates here. Great, so I've got my template, I'm ready. Let's go to campaigns on the left and we go to trigger words. This is where we assign a clinical code to a given trigger word. Again, I've got a few examples here and we're working off clinical coding here. If you are using SNOMED, we're fully compatible with that. Just let our support team know if you're using SNOMED and we will flip your Connect system over to SNOMED codes for you. I'm going to add a new code. And in this case, it is for flu invites. My trigger word was the word decline. I'm popping that in capitals again. Doesn't matter if the patient text upper or lowercase, it's just so it's clear for ourselves. And then we add a clinical code. Now, we would suggest checking in your clinical system for the code you would like to use. And then you can copy paste that into here. And when you do so, if it doesn't pick it up straight away, just delete the last digit and you'll be able to see it picks up and you can populate the term below. When setting your end date, make sure that you put a good couple of weeks, even a couple of months on the end date, because you want to catch all your responses, those ones who respond quickly and those who want to decline but then forget and then text back a couple of weeks later. And there we go. We have our flu invite and we have our clinical code here attached to the word decline and it's green. So we now know that when we send this out, the system is looking for that word to decline that flu invitation. Now, a really great tip that came from Roy earlier, which was using other trigger words as well. The example given was, for example, making the word yes a trigger word and putting it in capitals. If you would like to do that, you can do. As a tip, we sometimes say try to stay clear of words like yes and no, just because they can turn up in text messages with patients by accident. So if you wanted patients to indicate that they are ready to book for their flu jab, you could ask them to text back the word book, for example, because any word can be a trigger word. I'm happy that mine is now in place and coded, so I'm now going to go to campaigns and we send this by clicking new message. Now the next steps are really straightforward. We can again search by individual patient, but we're going to look for our group down here. There they are. We move them to the right. Once they're on the right, we click next. We look for our template, so I'm going to go looking, here they are. I select my template that I've already created, move it across and click next. And then I can schedule when it goes. So if you do have a few groups you need to send, you can send them at different times so that if you have just sent one group out, you can send one later, maybe after the bank holiday, for example. You can also control the time, which is 24-hour clock, so do be careful when checking the time. And you can also add a clinical code. Now, this is done just in the same way as you would do with a trigger word, but this time you're adding a code to the message you're sending itself. So I'm going to pop in the code here. It's picked it up for me, so I can select it. And now that's going to go back to the patient records for everybody that I'm about to message. I can even put some free text in as well if I need to, and that will go back with my clinical code here. Final top tip, always click on change for reply email because the system would like to keep you informed of any text responses from your patients, and it will do that by creating an email copy for you. The patients do not see this, they just text as normal, but you can control where it goes. So you would just ask the system to send it perhaps to a generic email, click the little plus button here, and once it's in the box below, click save, and we're ready to send. So we can click confirm to send. We can see the message at the top. We can see the number of characters being used, how many people it's going to. My system here shows 0 credits with a -5 afterwards. That might be how your system's worked in terms of how you're funded by your CCG. If you're not sure about it, please contact your customer success manager or our support team who can help you. We can see the clinical coding that's gone in, plus the reply email that's being used, and I can have a copy of this sent to the reply email as well. Once I click send, the system will let me know it's been sent. There it is. And I could find my message if I've queued it up to go in the outbox. I'll just refresh the page there. And there it is. Once it's been sent, I'll be able to see it in the sent box. And any patient replies, I will be able to find in messages, of course. Now, I know we're running a bit close to time here, but I do want to very quickly show you our call recall function as well for those practices that are using the MyGP app. Under campaigns, under call recall, we have the ability to send specific invites to our patients and give them a spot to book into. So as well as being able to maybe use a trigger word to indicate they want to book, you could actually, for those patients using MyGP, just give them the slot to book into. To do that, we click on Add New. And we need to enter our patients here in the first step. Now that's just the same as we did a moment ago, literally a moment ago. I'll use the NHS numbers this time as well, just to show you an alternative. So I'll make that NHS numbers here, paste them in, move them across, and there we go. We then get to add a specific message. Now what we can do here is add a message based on whether the message is going to someone using MyGP already, which is the box on the left here, or if it's going to someone who doesn't yet have MyGP, but you would like to let them know they're eligible for the flu jab and that they could download it to then be able to book in. Now, again, these templates are already available on the website, so I will show you where those are. And again, you can edit and change these as you need to. All you do is pop them in because the system will sort out who in your group has the app already and who doesn't. You can then give them a slot type to book into. And in this case, we've got the slot here of our demo site. For your own sites, it will show the slots available on your clinical system. So if I click on flu vaccination, I can then even name that slot for my patients. I can then say when this is due to be going in. So I sent the message for next Thursday, so I'm going to have the button appear for next Thursday. And I can tell the system when I want that message to be sent out. So I'm going to have it sent at the same time. We can even add a clinical code just like we did for our text message as well. Once done, we click confirm to send and the same process is available. You will get the message confirmation summary. Ooh, I've put a interesting error there. I'm not going to worry about that too much today, but we would click confirm to send. It will give us the confirmation summary and it will take it from there for us and send out that campaign. And then the clever thing is only those people in the group that you've sent to are going to receive the slot type to then book into. And that is a quick recap on call recall. For all the information that I've mentioned about the help site, all of that is available in the help button in the top right hand corner here. That'll take you through to the help page. If you're sending more coronavirus vaccination campaigns, there's a link here. Flu campaign overview is here. That's what we've gone through today. Everything you need is on this help page, and you could also do a search for anything you might need as well. And that is our call recall recap. I've kept your time long enough. We're going to now move over to the Q&A. So I'm going to hand over to my colleague Thor, who is going to run through a little bit on the Q&A for us. So Thor, over to you.
Hello, everyone. Hi, guys. Thanks for sending in your questions through. Also, I am mindful of the time, so we have gone over the end time of this event. So if you don't have any questions, don't feel obliged. You don't have to hang on. I'm just going to run through a handful of them that have come through and I haven't been able to answer, and I'll be done shortly. But if you don't want to stick around for the Q&A, by all means, drop off of the event. Okay, so quickly, I was asked if we can have access to this demo, so Dan's demo. So everybody, don't worry, a full recording of this event will be provided in a follow-up email sent shortly later today or early tomorrow. And so you'll be able to recap it. However, also in the chat, I've posted direct links for the flu campaign. So step-by-step guides and video tutorials on how to send out a flu campaign. I've dropped that in the chat. So you have full access to do the learning for that in your own time. And then also I've done one separately for call recall if you wanted to specifically find out and recap how to send out a call recall campaign. Okay, so then I'm just going to grab one more question. So Sue, thanks for your patience. I promised you I'd follow up on the question you sent through. So when Dan was doing the campaign, the flu campaign message, you asked, some patients send back no to decline. Will this be picked up other variations too? So as you can see, when he was programming in the trigger word, it's customizable. So you can program any type of word to be a trigger word and then assign a clinical code to that trigger word. So if you create a decline as the trigger word, then that is it. That's what it picks up. However, that's why we suggest you write it in big capital letters so patients know that expression stands out. You're not looking for any other variations. As the template sort of we provided and showcase says, please text back decline, big capital words, to refuse. Also, as you mentioned, if you program things like no in, you can run into the scenario where it will pick up in any sentence. So maybe they say decline, but then a variation of that or another sort of answer to a question they put in no, that's going to pick up. You want something very specific to be put into that template, and decline or refuse or reject are sort of the suggested ones. So yeah, I hope that answers your question. Going through it, that's really it actually. So thanks a lot for your Q&As, for your questions coming through. Also, if you have any other questions you didn't have a chance to type in, you weren't quick enough, you can always reply back of the follow-up email that we're sending out. So just send your questions through on that and we'll have a chance to reply to those later. Okay, thank you everyone.
Thank you very much, Thor. That's bringing us through to the end of the session today. Thank you, everybody, for staying with us a few minutes over time. Now, I know you're all thinking about that prize draw that Sim mentioned right at the beginning. It is taking place. It will take place after the event today when we can see the full list of attendees. And when we email out, everybody who's attended today will get a follow-up email with lots of links and helpful information, including a link to the recording. We will notify you within who was the winner. We'll be picking them out and contacting them separately. So thank you very much indeed, everybody, for attending. If you do have any final questions, pop them in the chat as we will be able to pick those up. But as I say, you will get an email from us to thank you for joining the event with some follow-up links. If you do have any questions, do feel free to drop an email back to us. Otherwise, thank you very much indeed for all your time. I think it's time for lunch, so thank you very much indeed, and we will see you next time. Thanks very much, everybody, and goodbye.